back to Body Beautiful. I'm Janelle Marie. I'm here with Dr. Joseph Mealy, and we're talking about all kinds of cosmetic procedures. Remember, any advice we give you today, consult your own physician first. All right, we are back, and we're talking about all kinds of things, and now we have liposuction.
Okie dokie.
I want to get right into the pictures because liposuction is very popular also. So we're looking at picture one.
And it's very visual, too.
It's very visual.
So this is someone who came in just with little areas of disproportion. She's in great shape.
Yeah, I know.
She works out. She's obviously not slacking off.
Right.
But you can see I've drawn little sort of a topographical map of the areas that we're trying to get rid of. So with liposuction, we can go back and just tighten those up.
So just very little liposuction there. You kind of just molded her stomach, it looks like, right? That's beautiful.
And in this case, I think I did a tummy tuck also because I'm looking at the side of the muscle.
Yeah.
You can see where that shadow is. It's much reduced. So I think also there's a little bit of a tummy tuck. But for her, again, mostly it's not skin. Mostly it's just that little bit of fat that's disproportionate and then the muscle laxity.
And when you only have to do limited liposuction like that, is the recovery time much quicker?
It is. Liposuction recovery is usually a week. Everyone's back to normal.
Oh, really? So it's not
it
too
feels
bad.
sore like a muscle workout.
Yeah, and not big scars.
Correct. The scars are a few millimeters.
So not too bad at all.
And we try to hide them around the corners and in the folds so they're not as noticeable.
So wonderful.
Yes, we're sneaky. So
picture number two.
This one definitely a tummy tuck with it. So what I've done is liposuction around the back, the sides, the flanks, and then that lower belly. Often with tummy tucks, we don't need to liposuction it. It just comes away with the skin.
With the tummy tuck, gotcha.
Yeah.
So you didn't even have to liposuct that part.
The most impressive thing is that is about 14 years after.
Oh, really?
Yeah, she still comes in to show off.
Wow.
Because she takes good care of herself.
That is really fantastic.
It's teamwork. I could do the surgery, but she's obviously doing more.
That's true. Because if you have liposuction, you can gain that weight back.
Yes.
And so does it come back in different areas? You know how you hear people, is liposuction, if you do it, does it come back in different weird areas that you never had weight before?
It usually comes back more proportionately because we've removed those sort of low number cells that get served first.
Okay.
But it can come back in the same area. It can come back only somewhere else.
And that was an email question, actually. I was so excited about that question. The question was, what if I gain weight?
Yeah, it's going to go somewhere.
Okay, it's going to, oh, geez.
So, yeah, the goal is to try and maintain the weight so we can maintain the result.
Yeah, because people think they can eat.
The next one is just purely liposuction.
Yeah, okay.
So next one, no tummy tuck, nothing else.
No tummy tuck, just liposuction on that one.
Yeah,
okay,
so what I've done is sort of sculpt out the back. It changes the shape of the buttocks.
It does change the shape.
Even without adding.
Yeah,
And before we really had Brazilian butt lifts, that's all we could do.
Right.
But by reducing that fullness above the buttocks, and then sometimes I'll reduce the back of the thigh, it gives more of a rounded appearance to the buttocks.
That's fantastic.
And then for the belly, obviously, we're always going for flat.
Oh, absolutely.
So flatter the belly.
Got to have those nice flat abs.
Yeah.
All right.
And this is just the lower back. So someone had a lot of stuff in the lower back.
What we call the muffin top.
Yes. And as is common, one side's bigger than the other.
Oh, okay.
So I've removed more from one side than the other. There's always going to be some asymmetry because the bones, the structures underneath, even the ribs may be in a little bit different space. But certainly we can make it better and get rid of a lot of that folding.
That is a beautiful after picture there on that one. Great result. And general anesthesia,
Usually,
yeah.
Yeah, I think it works better because I can just concentrate on what I'm doing.
Right.
There's an anesthesiologist there making sure the patient is safe.
Right.
It's not the cheapest way to do it, but it's the safest way we have.
And now, I think this is a man. I'm having the last picture.
You are
correct.
Am
I right?
That is a man.
We haven't talked a lot about men coming in for cosmetic procedures, but it's happening more.
Muffin tops, love handles, belly, and chest are probably the most common areas on men.
Really?
And for men, they'll get a little bit of gynecomastia sometimes, which is a little development of the breast tissue. So in this case, you can see it's full, but there's also like a little extra fullness underneath the nipple.
Yeah.
So what I've done is done liposuction to get rid of the fat that was there, and then remove that extra lump underneath the nipple by making a small incision around the areola.
And that is a great result. And a lot of men just do not want to come into a cosmetic office. But if they are feeling, I mean, what happens when you don't do that? Do you have a lot of pain?
I think usually it's not painful, but it can be. Some people when they have gynecomastia, it's really the gland developing. It can be achy and sore.
Oh, okay. So
especially if it's still growing.
Oh, okay.
And it tends to be more sore.
All right, so not a lot of scars on that, and recovery time's not too bad on liposuction, and you can do a big case or a small case, am I right? So, and combine a bunch of different...
There are limits to the amount that we can remove. We try to limit it to 5 liters of fat at a time, just for safety.
All right, good.
You know, there are folks who do more, but it needs to be done in a different way, not just outpatient.
Definitely want to be safe. All right, for more information about Dr. Mealy, you can give the office a call, 925-943-6353. Check them out on the web, drmealy.com or sanfranciscobreast.com. Before and after pictures are all there with lots of other stuff. We'll be right back on Body Beautiful.